I'm Louise Field, founder of Adore Your Pelvic Floor. We offer training days to health professionals, and we also offer the Adore Your Floor program to women in the community. And I have the lovely Diane Danzebrink.
Hello.
And Diane, she's a counsellor for women and their partners, and she also is a consultant in the workplace for businesses and organisations. Please take the time to look up Menopause Matters, or Make Menopause Matters, which is the campaign that Diane has been the founder of and has campaigned for. Okay, today we're going to talk about the pelvic floor and menopause specifically. It is a change in the woman's life where there are many changes with the pelvic floor, and we can often notice it with our bladder and our bowel.
Yeah, lots of women talk about those issues.
And it can be a taboo subject. My glasses are on now here.
Yeah, very much so.
Some of the things that can be noticed is passing urine frequently, rushing to the toilet, urgency. They are really, really common in the menopause. I have heard women saying that they've gone on to HRT, and the getting up in the night thing has actually really improved.
Yeah, absolutely. Yeah, and obviously that helps with stress levels, helps with their sleep, helps with them getting through the next day better.
Absolutely.
The other thing that's come up quite a lot is women and, being really embarrassed to keep going off to the loo during the day.
In the workplace.
I spoke to a lady the other day, and she had to leave a 1 hour meeting 4 times. She said, and I knew that everybody knew where I was going, and that was just awful. So as well as actually having to go to the loo, she's got the anxiety of that too. So I think it's so important that we understand this.
Well, we need to be able to perform at work, and we don't want to be that token person who's, like you say, going to the toilet all the time when it's obvious in a meeting. Everyone's realising it's a problem. I also hear of women having to take spare knickers to work, tights to work, buying tights when they're at work because they're not making it to the toilet in time. There's other symptoms though with regards to the pelvic floor and also the menopause as well, because it's a vulnerable stage in our life with regards to the pelvic floor. That's your stress incontinence, so that is on your cough, your sneeze, on your exercise. But also leaking your urine on the way to the toilet.
Yeah,
so that's
kind of
urgent
not
incontinence.
Yeah.
And getting up twice in the night or more. And frequent my word's getting a muddle. Frequently getting urinary
tract infections.
Oh dear. Rushing to the toilet to open the bowels. Inability to control wind. And constipation. Okay.
Yeah, they're all really common things that people report once we start talking about it.
100%. If we ignore these problems, they don't generally go away on their own, and quite often they'll get worse.
Yeah.
It can then interfere with work or your social.
Yeah,
life.
Absolutely.
And I have heard of women not leaving the house due to the fact that they don't want to get caught out.
Yeah.
And so then sometimes it's linked with depression thereafter. So we recommend that you get these symptoms treated. Women's health physios are absolute gold dust. They're just so knowledgeable.
A lot of people aren't even aware that there is such a thing, are they? As women's health physios.
Until a few years ago.
Well, I have to say, until I started doing this work, I didn't know either.
And I think actually we need to get that message out there constantly.
Absolutely.
That although there is only around 800 within the country, I'm happy to travel an hour to get to mine. Yeah. If I had to. Yeah. I really would. Because they give you a really good clinical assessment, and they also then can give you your exercise prescription.
Well, they're specialists, aren't they?
They are. So let's think about weaker pelvic floor muscles. Basically, the pelvic floor muscle group, they help support our pelvic organs. And that's our bladder, uterus and bowel, and to help keep them in their true anatomical position. We have less elasticity around the bladder here. The base of the bladder, I've got written down here, the base of the bladder becomes less elastic as we've talked about previous
Yeah.
videos, and therefore has more difficulty in stretching.
Yeah.
As the bladder fills with urine, this loss of stretch can irritate the bladder, causing it to be overactive.
Yeah.
Combined with your weaker pelvic floor group, it's harder to hold the amount of urine that it ideally would. So there is bladder training you can do, and there's pelvic floor exercises you do. There are specific exercises for that, and that would be your endurance contraction. Your endurance I don't want to talk too much about contractions, because if you get your contraction practice wrong, it's not going to help you.
Yeah.
We're going to do a separate video for that, okay? But there is a specific exercise program for your pelvic floor, and that would be your endurance that you would be working on. Vaginal dryness on the pelvic floor. Loss of estrogen, which results in dryness, which gives you so many different side effects or symptoms.
I don't think any of us, well, none of us at all, are we? Just how estrogenized that whole pelvic area is, and how much it relies on estrogen for its health.
Yeah, I used to have thrush all the time, but then I started getting so used to having thrush. I thought was thrush anyway. I was self-diagnosing, self-prescribing, and it was a big problem. This is going back quite a few years. All got sorted in the end, and it was about 2 months ago. I thought I had thrush again. And actually, it's down to vaginal dryness.
Yeah.
So there's so many things, isn't there? But the urethra can also develop similar changes. And that can also aggravate this whole thing of UTIs.
Yeah, and again, this lack of estrogen makes it all so much more delicate and prone to infection, etc., and prone to, kind of being just more vulnerable. So I think it's such an important message that you can help look after your own pelvic floor, but also that you can get help from your doctor in the shape of vaginal estrogens to help you look after it. It's a great combination, isn't it? Yeah. Especially if you can throw a women's health physio in there as well.
Weight gain. So that happens, doesn't it?
Yeah.
And again,
Absolutely.
There are lots of reasons due to metabolic rates and things like that. Is there a direct link, though, of hormones to that middle age?
So, as far as...
Tummy.
So, I'm often asked, does HRT make you put on weight? No, HRT doesn't make you put on weight. The change in your metabolism, and there is no doubt that as our estrogen levels change, where fat deposits changes too. So, does HRT make you put on weight? No, it doesn't. Can you put on weight and put it on in different areas in menopause? Yes, you can. Are there things you can do about it? Yes, there are. Do you always feel like doing those things? No, you don't. So it's complex.
Yeah.
And it's not, it's not one size fits all. Some of us are very different to others. Some women, some women go through menopause and lose weight.
Yeah. And thinking of the pelvic floor group in itself, if you've got extra load, I've got this great big bottle here. I love using things there. Look, extra weight there directly down into that pelvic floor group, and there's no bone because it would be wrong, is going to put added load into that muscle group.
Absolutely.
And it could further weaken.
Absolutely.
Yeah. Okay, other health problems here I've got. Diabetes has specifically been identified as putting women at higher risk, and nerve damage, neuropathy, me and my big words, is a common complication in diabetes. So the nerves to the bladder and the bowel can be damaged, causing a loss of sensation. And that
nerve network is huge, isn't it?
So huge.
When you look at bowel, bladder, vulva, vagina, it's a huge network.
Yeah, and that loss of sensation with regards to emptying your bowel. So that's another big thing with menopause and what comes with it, other health issues, i.e. diabetes, can sometimes occur at that age. Hysterectomy.
I'm really interested in this because this is me.
So, the uterus is part of our support mechanism for our bladder and our bowel, and all the fascia that's enveloping them all there. So if you have a hysterectomy, then there is actually a 15% more chance of a bladder or bowel pelvic organ prolapse. Just something that you want to be able to be knowledgeable about. So that
do you think, in an ideal world, do you think that every woman who either has a child or every woman who has pelvic surgery of some description, do you think that they should all have a program of restoration,
rehab,
to be able to help themselves, either from a women's health physio or from somebody like yourself who can give them that kind of factual, evidence-based information and advice about what they should be doing?
So
there should be a program. Okay.
If you have knee surgery, if you have knee surgery, then you wouldn't be climbing Snowdonia,
and you'd have
until
physio.
you've had rehab,
Yeah.
and you're fully back to functional strength. And yet you may have surgery post. It could be hysterectomy. It could be any surgery around your pelvis. That could be your hips and all these muscles are attached. You've got your glutes. You've got 45 muscles attached to that pelvis.
Yeah.
And how those muscles are reacting will play a part with your pelvic floor as well. So yes, rehab post-surgery, important for functional strength of what you require.
Yeah.
Right, so bowel control. Many reasons for a weakening of the anal sphincter. It can be when you're giving birth, if you tear, and it may not show up at that time in postnatally to be having a problem with that area, but it can show up later on in life.
Yeah, a lot of people talk about how their episiotomy scars become much more troublesome to them in that menopause, in those perimenopausal years and onwards, as that estrogen level depletes, and they're really, they're really struggling with those.
Yeah. So yet another thing that can coincide with the menopause and the pelvic floor that may start to suddenly show up. Good toilet habits, they are really crucial to helping us all. Don't go to the toilet just in case. We've been taught, we teach our own children that, don't we, before we go on a long car journey.
Yeah.
And then we're teaching them to empty their bladder before it's actually fully full.
Go and try.
Yeah, we're not leaving until
That's
we've had
what
a
I
wee.
used to be told. Go and try.
Yeah, absolutely. And we can easily get into that habit ourselves, or go into the toilet just in case.
Yeah.
Try not to do that. Do try. As far as constipation is concerned, the brace and bulge method. Have you heard of that?
No.
Oh, so good. So good. Michelle Kenway, she's got a really good video. So if you looked up Michelle Kenway brace and bulge, hopefully it will show you her video, because it'll be good for you to actually see that video. But it's basically, I call it breathing your poo out.
Right.
It's allowing that breath to ease down in towards your belly, into the pelvic floor.
So it's kind of using your breath to help that happen. Okay, that makes sense.
Well, some people may argue that because, but yeah, brace and bulge. If you look it up, you will get the complex video on how to do it.
Okay.
Basically, I find that if I use the brace and bulge, I empty so much more. And it can, if I didn't have the urge, then it brings the urge on.
Okay.
So I fully recommend the brace and bulge method, which I recommend you to look up. But also it's the squatty potty. I love the squatty potty.
Okay.
Yeah, you don't know about the squatty? Oh, the squatty
what
potty.
the hell is that?
Something else to look up is the squatty potty. They've got some brilliant, funny adverts.
Okay.
And you can even take it on holiday with you because they've got a portable version as well. So it's basically having your feet on a raised platform.
Right.
Your knees are wide.
Okay.
And so it opens up your hips.
Okay.
And so then it helps relax because your pelvic floor relaxes.
So again,
to
you're
let stuff
relaxing
out.
that. Okay.
So you need to better relax your anal sphincter, and also the Western toilets kind of shut off the whole travel of the the rectum for
Right.
the bowel waste.
Okay.
Whereas
Because of the design?
yeah,
Okay.
yeah. So like, if you go to a developing country and you see somebody squat to go to the toilet,
Yeah.
yeah, and that could be so. When I do a squat loo in the forest when I'm busting, yeah.
Mm-hmm.
You just go on and on and on. You think, oh my God, when is this going to stop? Yeah,
Okay.
yeah. Fully empty your bladder.
Ah, how interesting.
Yeah, and then you go on.
Because there have got to be health benefits to fully emptying your bladder.
Oh, yeah.
Because it's not sitting there, is it?
Yeah, absolutely. Because right, God, we're going to get onto the subject now. Women don't spend enough time on the toilet.
Okay.
Yeah, so we are too busy. We're like, oh, I've got to go and do that.
I'm just
so
going to run
even
for a
having
wee.
even for the wee, we kind of like already wiping ourselves before we kind of maybe fully finish. Give yourself time to just make sure you're fully relaxed. You've had all of your wee. Again, I could talk about this very on and on and on.
Oh my goodness, that is the real extreme of living a fast life, isn't it? Not even having time to finish your wee. That's quite scary.
I think also they see we can draw up on that pelvic floor before it's fully finished.
Am I going to really throw this completely out of whack? Just bearing in mind that a lot of people that are going to be watching this have got men in their lives.
Yeah.
Am I really going to destroy this if I ask you about men?
What about men?
Well, kind of surely all of this kind of applies for their health too.
Oh, absolutely. But how long do men... I mean, like, okay, so my husband, he'll announce, I'm going to the toilet.
Okay.
Yeah? I will get my washing washed. It's on the washing line and it's dried. I don't iron, but I'll shake it out and put it away, and then he comes out the toilet. Yeah.
Okay.
So if we're talking about,
So it's a bit of a ritual for him.
Well, yeah. Does your husband not spend a long time in the toilet?
He probably does actually. I don't really think about it. He doesn't announce. Oh, do you know? Thinking about it. Sorry, Martin. Do you know? I have to think about it now.
Oh,
maybe it's just because maybe it's because I'm not around very much. Maybe because I'm too busy.
Okay. As a whole, men will generally spend more time.
But what about
the
urinating for men? Because obviously it's a different.
They've got a different process.
Different process.
So they get their pelvic floor issues as well, and they will have the after dribble, don't they?
Mm-hmm.
Yeah. So they need to strengthen their pelvic floor.
Okay.
But men get tight pelvic floor, hypertonic pelvic floor, or areas of the pelvic floor as well.
Okay.
As women.
Okay.
So men can have pelvic pain.
Okay.
And issues of their pelvic floor.
Okay.
In basically very similar things to us.
So when you just said about kind of they've gone for a wee and then they've had that kind of after dribble.
Yes.
That's because they need to.
Now,
is that rushing is that?
No, there could be that they actually need to practice their pelvic floor contractions.
Because I don't really hear about men being told. It's something that I hear a lot about for women.
Yeah.
But I don't really hear about it for men. I don't really hear
with
about.
regards to their pelvic floor.
Yeah, I don't really hear about.
That's another video.
I don't.
They
really
do
hear
their
about
pelvic
them.
floor the same as us. It just looks.
But you
different.
never really hear about it, do you? For men, and I don't see why it wouldn't be equally important.
Oh, it is. It is, and in the pelvic health world, it is as important. And goodness me.
But it's just kind of like not out in the wider world.
No, it needs to be.
So
men are more open about it.
We need to be doing stuff about this, don't we?
Men are more open about it than what we give credit for, men. There is an article I shared this week where you get your ladies' pads and you get your men's pads, yeah? And
let's not get started on pads.
No. But then the men, when they go to the toilet, if they're having to change their pad, if they're in a public cubicle, there aren't any those bins. Yeah, and I really think that's actually very important.
Gosh, so for men that have undergone some kind of surgery.
Yeah, prostatectomy.
Gosh, that's awful, isn't it?
Yeah. We are really going on with
Sorry.
this. We've
gone completely off on a tangent.
Menopause to now men.
That's
but it's
all my
important.
fault.
It is all so important. But no, men get constipated, women get constipated. Women, though, have got a particular, what's the word? We are more likely to be in a hurry. We're more likely to I'm only going to do my number 2 when the urge is really strong, and they will rush it and maybe not fully empty. And constipation. Men are a bit more leisurely about it all. God, yeah. I don't know what your Martin does. He's obviously he's unusual. He's unusual, isn't it? I'll tell you, your comments will be like, my husband's always in the toilet.
Do you know what it is? He'll watch this and he'll cringe, but he'll also go,
sorry, Martin.
I'm horrified that you don't take more notice. Bless him.
Men spend hours in the toilet.
Bless him.
And we have really touched the surface, because I can talk an hour about constipation and best toilet habits, but we really do need to understand that, yes, that's yet another thing that can occur around the menopause time when we're more vulnerable, and to use the brace and bulge method.
Yeah.
And the squatty potty, because you're going to empty better, and less strain. Mm-hmm. Don't strain, ladies. Breathe your poo out. Yeah.
So are there resources?
Yeah, do that.
Oh, go on. What am I doing?
Now do Pizza Hut. Go on.
Pizza Hut.
Right, that's like the brace and bulge.
Okay.
Yeah.
So are there resources that people can find on your website for this?
Not on my website, but the in the Adoy Floor program we go through it.
Okay.
So on the Adoy Floor program, but if you are just wanting to know more information, I would really look up Michelle Kenway.
Okay.
Yeah, she's got some really good video resources with regards to all of that.
Really important for people to know that A, there are things that we can do for ourselves, and B, there are things that doctors can do to help us as far as those vaginal estrogens, etc. are concerned.
Yeah.
Cool.
Makes a difference.
Thanks, lovely. Fab.
Oh, God, I could talk all day. But you don't want to hear that. Bye-bye. Thank you.
Bye.